When we approach the volumes that we achieve in a patient, that's a variable that, again, depends on a number of those factors. The tissue thickness that we've talked about before, the density of the tissue and its compliance. Now, I will maximize what I do for a patient in a single session, but all of those are variables that I have to deal with. There are patients in which we may achieve just about 300 cc's in each breast, but that's maximizing what we can do for them. There may be patients that you see where they get achieved 500 and 600 cc's, but the factors were different, so that maximizes what we can do for them. It doesn't mean that they necessarily, it doesn't mean that the patient who gets a lesser volume has a lesser result. It's pretty amazing, as I said, how those variables have a lot to do with the chest wall, the petiteness of someone's structure versus, whether the thorax is a little bit wider. So the results, as I said, are always significant, in our patient population, but those absolute numbers don't get too confused about an absolute number and what it really means. And I think that a lot of patients, when I'm talking to them, I tell them how I prepare the mixture that we're basically placing in the breast. Because I use this tumescent liposuction technique to pull the cells away, that's flooding those areas that we're harvesting with IV fluid, so that IV fluid gets pulled away. It helps to maintain the viability of the cell, but we don't need all the IV fluid in that mixture, so we do centrifuge it. And I don't centrifuge it at too high a rate. I only centrifuge it to a point where I take most of the IV fluid off, but I still leave 20 to 30% of the mixture that we're placing into the breast as some IV fluid. The reason for that is that's what I found works for me. All right. Again, you try to find things that work empirically in your hands. I believe that it helps my predictability and consistency because it helps to float the cell back in without damaging it, but also to distribute it among the tissues that are there. A little bit more of a fluid medium, I think, helps. And so when we're putting the new cell in contact with the cell that's already there, that fluid medium is a little bit easier to deal with for me as a sculptor. And that's where you're going to see the differences. So when we put 500 cc's in, 20 to 30% of that may have been some IV fluid. That's going to get resorbed, okay? But 60, 65, 70% often is there at the end of the 3 months. So we know most of the cells seem to be making it. So that's a better way to look at it. Keep in mind that, a good bit of this may be some IV fluid. It's going to get resorbed. But it's about retention from the standpoint of cell survival that's important.